So in the last class, we talked about hypothesis and research approach. So we said hypotheses are scientifically reasonable predictions, what others would like to call educated guesses that we use in our research. We test our hypothesis. And the speaker from last class also established that hypothesis, there are two forms of hypothesis. He said there's a null hypothesis and there's also an alternative hypothesis. And he said from the null hypothesis is a hypothesis of no relationship, no difference, or there's no relationship or no difference, no significant null hypothesis, and also the alternative hypothesis. So there are two types of alternative hypothesis. We have the directional hypothesis and the non-directional hypothesis. So for the directional hypothesis, it's one-tailed. That is, there's a direction to it. It is one-tailed. While for the non-directional hypothesis, it is two-tailed. There's no direction to it. And he gave us lots of examples from his last session. One example I have for us tonight is, if you have a research question like, does increasing the daily intake of vitamin C reduce the frequency of cold? That's a research question. If I want to state an alternate, a null hypothesis, I'll just simply say, increasing vitamin C intake does not reduce the frequency of cold. Now, this one has a direction. Does not reduce the frequency of cold. And my alternative hypothesis will be increasing vitamin C intake reduces the frequency of colds. Now, if I'm going for a two-tailed hypothesis, it will sound something like this. For the null hypothesis, increasing vitamin C intake has no effect on the frequency of cold. So that's how the null hypothesis will sound. It's not telling us if it's increasing or decreasing. There is no direction to it. While for the alternative hypothesis, you have something like increasing vitamin C intake affects the frequency of cold. So it's just a summary of the hypothesis we talked about in the last session. Then he also spoke about research approach. He told us that there are two types of research approach. There's a quantitative research approach and there's a qualitative research approach. For us in the sciences, medical sciences, what we do mostly is quantitative research approach. However, we are beginning to embrace mixed method. When you're using the two methods, both quantitative and qualitative, you have a mixed method of research approach. For the qualitative, it helps us explain why people behave the way they do. For example, you understand why. You cannot quantify why someone acts the way they act. So for you to understand why people behave the way they do, you need a qualitative research approach. So for quantitative, we use it to for measures, for research that we have to do lots of measurements and all that. So we have quantitative research approach, we have qualitative research approach, and we also have the mixed method. So that brings us to what we are going to be talking about today. So for today, we are going to be talking about descriptive, that's this descriptive research design. And for descriptive research design, it is under observational research design. So when you bring, there's a broad table, a broad chart, this is it. There's a broad chart, study design. This study design is actually quantitative study design. That's what we are focusing on tonight, not qualitative. We already established that there are two types of study design, quantitative, qualitative, and when you are using a bit of the two of them, you have mixed method. Now, under quantitative study design, we have experimental and observational. So there are two types, experimental and observational. So let's look at what study design even means. So for study design is a procedure under which a study is carried out. The procedure under which you want to carry out your study. Remember that we already established from the beginning of the class that research is a systematic investigation. So there is a procedure to carrying out research. Research is not done haphazardly. So for your study design now, study design is a procedure under which you want to carry out your research. And if you are using a quantitative approach, research approach, your study design can either be experimental or observational. If I'm going to be intervening, if I'm going to be giving you maybe drugs to check if your blood pressure will increase or decrease, then I'm intervening. If I'm intervening, then it's an experimental study design. It's an experiment I'm carrying out. However, if I'm just going to observe, if I'm just going to watch the entire process, then take my measurements or my records, then is an observational study design. So there are two types of quantitative study design, experimental and observational. And for tonight, we are going to be focusing on the observational. So just be mindful of how the chart is coming down. We've established research approach, quantitative and qualitative. And we also said we have the mixed method. And under the mixed, under quantitative, we have experimental. That's when you are intervening as a researcher, and observational, when you are not intervening, when you are just observing the outcome of your research or whatever it is you are working on. Now, for observational research, research design, the investigators study people and exposure in nature. So you don't alter their environment. You don't put them under a controlled system. You don't do anything. You just watch them in nature. You watch the entire process. For instance, you just watch people, maybe diets, and the outcome should be their weight at the end of it. You take measurements of their weight at the end of it. You are not the one controlling their diet. You are not telling them what to eat. You're not telling them what to drink. You just watch them. But you actually, have for the records, you have to know what they are eating and what they are taking, so that by the end of the day, you'll be able to make sense of your research. So identify subjects, then observe and record the characteristics of interest. Is it height? Is it weight? Is it blood pressure? It could be anything. You just observe and record. So it does not involve intervention. We already established this, other than to record, to count, or analyze results. So you are not intervening, you're not introducing anything, you just observe. So observations are readily obtained, but subject to bias. That is systematic error. So systematic error can actually occur in this kind of research because you don't have a controlled or an ideal environment. So they can be subject to confounders. You can't control for confounders. As we go deeper in the course, you understand what confounders actually mean. So you can't control for confounders. That's confounders are variables that distort, they intervene with your outcome variable. That's your dependent variable. They alter your results. They make you feel that there's a reaction happening when in true sense there is no reaction happening. So we'll explain that when we start talking about variables and measurement scale. So observational studies are prone to biases, errors, intervention from confounders, and all that. So these are parts of the limitations of observational quantitative research design. So now when we bring it down to observational, there are two types of observational research design. We have descriptive and we have analytical. And the descriptive is where our focus is for tonight. So for descriptive method, which is designed to describe occurrence. And when you are describing an occurrence in research or in descriptive method, you describe by person, place, and time. And that's the same way you describe even in epidemiology. When you want to describe a situation, an occurrence, a variable, or a research or descriptive research, you describe by the person. Who is this person? What's the age of the person? What's the gender of the person? What's the body weight of the person? We describe by place, demography. What's the place of the person? And what time, at what time is this thing occurring? What time or in the process of your research? Is it at the beginning, the middle, or at the end of your research? Or what time of the year, or depending on how you are viewing your time. So for descriptive research, we describe by person, place, and time. And analytical, we also have analytical. Analytical is going to come up in our subsequent classes or sessions that we are going to be having. So just for the records, analytical method, which is designed to examine etiology and causal association. So you take it a step further for analytical method. You design etiology and causal association between variables of interest. For descriptive, it helps you come up with hypotheses. Remember, we talked about hypothesis, the null and the alternative hypothesis. So when you do a descriptive research, we use a descriptive research design, which we're going to be looking at, you begin to come up with hypotheses, educated guesses that you will now have to test in a further research. Okay. So this is the charts of what we've been talking about. We have observational. Under observational, we have descriptive and analytical. Under analytical, we have case study or case reports, case series, and cross-sectional. While under analytical, we have cohorts, case control, repeated cross-sectional, and correlational. So for these three, we are going to be looking at the case reports, the case series, and the cross-sectional tonight. Those are the three kind of study design under descriptive research design. So for the descriptive method, so they are used to generate hypotheses. I said that earlier. You use it to generate hypotheses. Then you describe the study design using case report, cross-sectional before. I'm sure you must have heard case reports or case series before. Well, let's look at it in-depthly. What's case reports or case series? Let's start with case reports. So for case reports focuses on a single patient or small number of patients. So it typically describes a unique, rare, or novel condition. I'll take that again. So case report focuses on a single patient or maybe a small number of patients, and it describes a unique or a rare or novel condition. You cannot be writing case reports on malaria or diabetes. No, there's a lot of knowledge, there's a vast body of knowledge around those diseases or ailments. So case reports deals with when a condition is rare, is unique, is novel. Probably you just as your place of assignment, you see someone with teeth on his head, or a baby that was born with teeth on the face, or something like that. So that's like something you don't see always. Is rare, is a rare condition, or something novel, or something unique. Maybe it could be response to treatments that you've not seen before, a side effect of a drug that you've not seen before, or the outcome of a particular treatment, or even the condition itself that you've not seen before. So that's when you write your case reports. That's when you write your case reports. Now, the purpose of case reports is that you try to highlight an unusual presentation of the disease. You highlight those things that are unusual, those things that that are rare, that you've just seen in this particular patient or in a small number of patients. They're usually talking about the same diseases. So you can't, case reports are not for different diseases. Do you understand? The patients have the same disease that if you're writing for more than one person. So there are rare side effects of a drug or a novel approach of treatment. So for case reports now about the patient, you might not put up something like the history of the patient, the symptoms, diagnosis, treatment, and outcome. So like we have on the slide, say this consists of either collection of reports on the treatments of individual patients with the same condition, emphasis on the same condition, or reports of a single patient. So that's your case report. Now, case series now is what is a compilation of case reports. If I have, if I compile all the case reports I have, it becomes a case series. So for case series, the group of patients with similar diagnosis or similar condition or treatment that's what you compile into your case series. So it provides broad understanding of the disease or condition and help you describe patterns and trends. So for the goal of the case series is that by the time you put all these case reports together, you begin to observe patterns, you begin to observe trends in these cases and multiple cases. You are able to explore all the cases together in your case reports, in your case series rather. So you are able to come up with hypotheses. Remember that in this case report and case series, you've already described them by person, place, and time. Is someone speaking, please? Okay. Okay, sorry. By person, place, and time. So looking at a case series now, you can have a clinic that treats, let's say, for instance, 20 patients with a rare type of cancer. So the researcher will now compile their data into case series and summarize them based on demography, based on risk factor, based on symptoms, based on treatment method or outcome. Now, this compilation will now help, it forms basis for further research. Most of all the diseases that we are able to find solutions to, some of it came up from case series, from case report to case series, and they're able to conduct further research on them. Now, to differentiate these things, let's talk about the aspects, the case reports, and the case series. Imagine a table like that. Now, for aspects, for case reports, the number of cases a case report should have, usually for a single patient. Case reports are usually for a single patient, for a single patient. While case series is multiple patients with similar condition. Are we together? Multiple patients with similar condition. While the purpose, for the purpose now, a case report highlights unique or rare cases. So when you see a unique case, you just quickly put down a case report on it. It's a type of descriptive, observational, quantitative research design. While for case series, it identifies patterns and generates hypotheses, because you are working with a compilation of cases. So from that case series, you can identify patterns. These patterns can now help you come up with hypotheses. The main goal of a descriptive research design is for you to be able to generate hypotheses from it. So the scope for case reports is narrow because you're talking about just one patient. While for the scope for case series is broader in perspective. So for generalizability is limited. For case series is also slightly broad, but it's not definitive, because there are other researches that have more evidence, that will help you knock out all the myths and everything and give you more concrete and definitive outcomes. So they are usually not generalizable. They are limited in their generalizability. So that's case reports and case series. Now, for example, we have an example on the slide. An example says you have a patient that have a condition that you are unfamiliar with. You would search for case reports that could help you decide on the direction of treatment or to assist on diagnosis. So if you have a case report or a case series similar to the condition we are treating at a point in time, you can reach out to it, to help you treat and diagnose. Okay, case reports and case series have no control group. They do not have a control group. So they have no statistical validity. So you are not comparing them with another group. There's no grouping to case reports. You just write it the way you see it. So I cannot be writing a case report or a case series and I'm grouping people into group A or group B. You write about them, you summarize them, you describe them the way they are. So you cannot be doing any statistical test. Since there's no grouping, you cannot be doing a chi-square t-tests because there are no groupings here. The most you can do your frequency table and just do descriptive descriptive analysis on them. So this is just it. These are charts illustrating how it looks. Use individual cases put together to chart notes, or let's say case reports, and with the compilation of all these case reports will now give us the journal article or what we want to call case series. Now there are advantages of case reports and case series. Now for case reports, is useful in the formulation of research hypotheses. Case report is useful in the formulation of research hypothesis. Like I said before, it's suggestive of risk factor. When you are writing and compiling your case report, maybe from asking your patient questions, you begin to observe certain risk factors. You begin to see, okay, maybe these patients have been exposed to maybe alcohol or smoking or some certain risk factors. You begin to see similarities in them, and also you can now develop or write your hypothesis, which you test using other types of research design. So important step in recognizing new disease and risk factors, because they are used for rare cases, is a very good step for you to use in use it in recognizing new disease and risk factors. So while you are preparing your minds to carry out your research, as you go for your postings, probably your rural posting, and you observe a very rare condition and you could quickly put up a case report from it and it will be published. As long as it's evidence, there are evidence and everything, it will be published, and that's a paper. So it's also a type of research design. So they are easy to understand and can be written up in a very short period of time. You can write it in a very short period of time. I know someone like Senator Chris can write it in 2 hours. You can just sit down and write your case reports just like that in a very short period of time. So these are the advantages of case reports and case series. Now let's look at the disadvantage. For case reports is based on the experience of one individual. So the presence of any risk factor may be coincidental because you're just seeing one person, and probably the person smokes, the person drinks, the person is exposed to maybe ultraviolet lights, and the person just, you cannot base that risk factor and generalize it to everybody. That's why the generalizability is limited. So you cannot, the experience of one individual, the presence of any risk factor may be coincidental. So you cannot isolate a particular risk factor from a case report and say this is a risk factor for disease ABCD. So there are other kinds of research that will help you eliminate all those kinds of bias. You can now come and do something like a case control study or a cohort study. You take it further, you begin to do experimental studies, meta-analysis, systematic review. These are levels of evidence that you can now establish the fact that this risk factor is attached to this particular disease. Are we together? Are we together, please? Okay.
Yes, sir.
Yes, you are. Yes, you are together.
All right. Okay.
Yes, ma'am.
So, all right. Thank you. You can't use to test for a valid statistical association. Yes. So you cannot say there's an association. You can't do a valid statistical test, or you can't test for an association because there's no comparison group. To do a chi-square, you need 2 groups. To do a t-test, you need 2 groups. To do ANOVA, you need more than 2 groups. So you cannot do those kind of tests on a case report because they don't have a comparison group. So these are the disadvantage. But it's a good place to start. It's a good place, to attach your name. Oh, the first person to discover I've seen this in this part of Nigeria, or in this part of Plateau State, is titles or something. Then can merely raise the question of an association. Yes, can merely raise the question of an association. You can't tell. You can't really tell if there's an association between smoking and lung cancer, for example. I know that has been established, but for example, if you meet someone with lung cancer for the first time, you cannot say if there's an association like that. Okay, so that brings us to cross-sectional research design. Cross-sectional research design. So having established what case reports is, case series is, comparison between case reports and case series, the advantages and the disadvantages. The next level is cross-sectional. Now this cross-sectional is what a good number of us will be doing. Most people like to do for a start because it's less expensive, it's direct. I think it's what most people know as research, cross-sectional. So for cross-sectional, it's also called prevalence study or instantaneous study or simultaneous study or a snapshot. And why it is called these names is because when you come for a cross-sectional study, you are determining both risk factor and outcome at the same time. So you cannot tell when a particular disease started. For instance, if I meet a group of elderly people and I'm trying to maybe determine the state of their maybe diabetes or blood pressure, I can ascertain both the risk factors for diabetes at the same time, maybe their sugar level, this and different questions, and also ask if they have diabetes, yes or no. So I'm taking both the risk factors and outcome at the same time. One of the major ways they do a cross-sectional study is using questionnaires. I'm sure at one point in time or the other, you must have filled the questionnaire. They're asking you so many questions at the same time. They're ascertaining risk factors, they're ascertaining outcomes at the same time. So it's also called a snapshot. So a cross-sectional study is one in which subjects are sampled without respect to disease status and are studied at a particular point in time, as in a random sample health survey. So you take them, whether you have disease or not, whether you have the risk factor or not, you are getting these persons, you are filling your questionnaire, you are ascertaining both risk factor and outcome at the same time. So these studies are obviously most useful for conditions that are not rapidly fatal. So not terribly rare, use it for conditions that are not rare, unlike the case reports and the case series, and are not routinely brought to medical attention. If you want to maybe check for prevalence of hypertension among adults in Lantern community, so you just go there and you are doing, maybe you are taking their blood samples at the same time. Normally, if you want to ascertain hypertension, you need to give few hours to take the first, second, and third, but you're taking everything at the same time, saying, okay, this one has, this one doesn't have. It's not like it's a rough study. It's still, it follows a systematic approach also, which is also reliable. However, the most you can do is generate an hypothesis from your cross-sectional study. So you cannot do it for a disease that is rare. Imagine doing a cross-sectional study for COVID now in this state in Nigeria. How many persons are you going to get, that have COVID now as we speak? So you can't do it for a rare disease or a rapidly fatal disease like okay, I've forgotten the disease name, just skipped my rabies. Like for something like rabies, where victims die within hours or days. So you can't do cross-sectional study for those kind of disease. So the exposure and disease outcome are determined simultaneously. So you determine the exposure and determine the disease outcome simultaneously together. So as you're asking them about the risk factor, you're also asking them about the outcome of the disease. Just like asking someone about their lifestyle, and you're also asking if they have diabetes. So you're determining exposure and also determining the disease at the same time. So you identify prevalent cases. So the cases existed at the time of the study, but do not know their duration. So it tells you, the most you know from a cross-sectional study are the number of persons you met at that time that have maybe hypertension. So you don't know how long they've had the hypertension. You don't know how long maybe they've been diabetic, but you're just taking it as a snapshot. The people you met on ground, you've taken their data and you're using that to calculate your prevalence of this disease in the community. So the cases existed at the time of the study, but you don't know the duration, how long, you don't know how long they've been having the cases. So a cross-sectional study measures prevalence and not incidence. Incidence are number of new cases, while prevalence are number of cases that are already existing at that time that you have come to collect your data. So we don't know the incidence, we can't tell the incidence rate from a cross-sectional study, but you can tell the prevalence of that particular disease at that time when you are taking your data. So that's why it's also called snapshots, or cross-sectional study design. So we have example here. Oral health knowledge and practice among pregnant women attending antenatal clinics. So you just, of course, you calculate your sample size. It's not done haphazardly also because it's a research. You come, collect, distribute your questionnaire, or you do interviews, depending on how you want to, questionnaire rather. You distribute your questionnaire to the pregnant women attending the clinic, and you assess their knowledge, their oral health knowledge and practice among them at that time. So you are taking the prevalence among that population. So awareness of preventive dental care measures among parents of preschool children. So these are ways, these are examples. There are lots of examples of its awareness and knowledge of oral cancer risk factors among smokers in dental clinic population. So you have your population already, so you know who your population is and where to get the data at once. So in the cross-sectional, there's nothing like follow-up. You don't call them back to take another data. So as you have collected it at that time, so that's data you have. You don't come back, say, oh, come back in the next 3 days. Or, for cross-sectional study snapshots, you take your data once and follow. So for the strengths of a cross-sectional study we can study entire population or a representative sample. So you can either do a census that study the entire population if it's possible, or a representative sample. If my study is for everybody in this club, I can decide to sample everybody in my cross-sectional study. But if I'm going to sample all the medical students in UJ, University of Jos, then I'll have to maybe do sampling because that might be overwhelming for me. I'll just have to calculate my sampling, do sampling, and get a sample size that will be representative of the entire population and collect my data from them. Then it provides estimates of prevalence of all factors measured. So it can tell you when you do your cross-sectional study and you begin to analyze your data, you can now tell the prevalence of all the factors that are measured. Maybe you have prevalence of smokers among the community in Lantern you went to. Prevalence, you can tell how many persons smoke, how many persons do not smoke. So you can calculate prevalence from that data. Then he has greater generalizability, unlike your case report and case series, because in this case, you are either doing the entire population or you have calculated a sample size that you can generalize the entire population. Then for the weaknesses, it is susceptible to selection bias. Susceptible to selection bias. So you might not get your determined sample at the same time at once. So you might just want to pick, okay, this one can answer, like this one cannot. So there's selection bias on your part as a researcher, maybe by persons you meet or something like that. So it's susceptible to selection bias. So information on all factors is collected simultaneously. So it can be difficult to establish quantitative cause and effects. So you are collecting information on all the factors at once. So you cannot even tell, there's no temporal sequence. You cannot tell if the factor, if the risk factor or the exposure precedes the outcome. So if someone have lung cancer and he has filled out your questionnaire, you cannot tell if this person had cancer before they started smoking, or this person started smoking before they had cancer. So you cannot establish a temporal sequence in a cross-sectional study. It's not good for rare disease or rare exposure. Yeah, I've said that before. It's not good for rare disease or rare exposure. It's good for disease that you can easily, get people or get samples of population. It's not good for disease that is fatal, particularly that someone can easily die from rabies. Okay. So descriptive study summary, like I said, we'll be talking about case report, case series, and cross-sectional. So summarize for descriptive study generally. It often uses routinely collected, readily available data. So descriptive studies, you use routinely collected data, readily available data. It is less expensive and time-consuming as compared to analytical study. Yes, it's less expensive and less time-consuming because when it comes to analytical study, you now have comparison group. Now it's deeper. There are lots of rules that guide your analytical studies that you must, go by. And there are different kinds of analytical study, and it's interesting. When we begin to unfold it, you find it's fascinating actually to learn and know these things and be able to apply them to your research. That's the beauty. So good for assessing prevalence and patterns of disease occurrence. So it's good for assessing the prevalence, it's good for assessing the patterns of disease occurrence. So it's useful in the formulation of research hypotheses. There is no other kind of study design, formulate hypothesis. The others, you probably will be testing your hypothesis. So it's from a descriptive study, you generate or formulate hypothesis, and is suggestive of a risk factor or exposure. Emphasis on suggestive, because by the time you analyze your data from a descriptive research, you begin to see what risk factor is common, or which of the risk factor or exposure is common among these cancer patients. Now that will lead you to the formulation of your hypothesis, like saying something, there is no association between smoking and lung cancer. Now, where do you get that from? Why smoking? Why not say eating rice or something? Why not some other risk factor? Why not some other exposure? It is because of your descriptive study that's giving you a pointer. It has suggested to you that smoking is a possible risk factor. So your analytical study now begin to test your hypothesis. Then you take it as higher as possible based on the evidence you need. Then for the disadvantages, it usually cannot test epidemiologic hypothesis. You cannot use it for hypothesis testing because what you do with descriptive research design is to generate hypothesis. It lacks comparison group. For comparison group, you need analytical study, and cannot usually discern temporal relationship. That's the temporal sequence. So you cannot tell if smoking came before lung cancer or lung cancer came before smoking. So you cannot discern temporal relationship. And it's not useful for rare events. It's not useful for rare cases. There are other study design that are best for rare cases, but for descriptive design, not so bad, not so good for rare cases. However, when you bring it down to case series and case reports, that's best for rare cases. Now, this particular line or this bullet point here is actually referring to the cross-sectional. So this summary of what I've been talking about, I started from the research approach. I said we have quantitative, we have qualitative, and we have a mixed method. Then I said under quantitative, we have observational, and we have experimental. So tonight we're looking at observational, and I said under observational, we had descriptive and we have analytical. And our goal for tonight was basically descriptive research design. And we talked about case reports for single, individual, rare cases. We talked about case series. We said it's a compilation of all these case reports together, similar cases, similar conditions. And we talked about cross-sectional. We said it's best to use in ascertaining prevalence of a disease. And we also said in general that descriptive study design is used to formulate or generate hypothesis. Thank you for listening. Any question? Dakat, you have a question?
Yes, thank you very much, Ma, for the session. I really learned a lot. So I want to ask about the case report. The first time I heard about a case report was about 3 years ago, before I started my clinical years, and basically I just heard about it, but then I was not able to come across samples of case reports, and basically something that will guide me to understand how it's supposed to look like. Like, is it supposed to just look like a clicking or what? So I don't know if you have any resources that would be helpful for us to see a sample of a case report or a case series that we can use to understand basically how it's supposed to look like. Thank you very much.
Okay.
Sorry, Favor, can I attempt a response to that question?
Yes, sir. Yes, sir.
All right, thank you. Beautiful presentation. Beautiful presentation. I really enjoyed it. Thank you very much. So, Chris, when we say case reports, like Favor emphasized, it's actually something unique, something rare, something strange, something novel, something you have not seen before. I wanted to come in because of the example that you gave, maybe like in the clerking, like you are clerking a patient, you know. So that is a classical example of a case report. So while Favor was talking, I just cast my mind back to some funny experiences I had as a medical student, where I saw some cases that were new, so to say. And I recall the example of a particular patient. I was doing an oral examination, and what was this man's problem? He was convinced beyond unreasonable doubt that whenever he spits out, what comes out of his mouth is kerosene. I was young, I was new in the clinic, it was weird. And I looked into the mouth, I checked everywhere, I did not see any fuel station or whatever, but he was convinced that anytime he spits out, what comes out of his mouth is kerosene. So I wrote down everything about the man, his age, his gender, his work, his family status, social history, all manners of stuff, in his presenting complaint. And then I had to go and call my consultant that I'm seeing something new that I don't understand. So that is an example of a case report. It's one person. You get the point. One person having a weird, presentation that I have never seen about, I've never heard about, I've never read about, and then that is a good example of a case report. So now let's assume that maybe I saw that particular patient on a Monday, and maybe by Thursday of the same week, I saw another patient always also complaining of a similar experience that their saliva is kerosene. Now I have two. If I now compile those two together, that makes it a series, because I have two weird conditions that are similar. So I will now write about the fact that, okay, I have seen two patients, maybe both of them are male, maybe both of them are female. I write, like Favor said, you just describe the person by place, by time, by gender, by their person, demographic characteristics. So I describe that. Or it might even be that I saw this particular patient, for example, in Jos, and then somebody claimed that he saw something similar, maybe in Imo State or in Lagos, and the patient there were also complaining or presenting with a complaint of saliva that is kerosene. So if we compare or compile our different clacking sheets, or patient history, and we put up a write-up, like a summary of what we saw, that makes it a case history series. But if it is just one case that we have, that makes it a case report. Another example I will give you is still during my medical school days. There was another person I saw that was showing me in his mouth that this hair on our head, that hair is growing in his mouth. I looked at it. He was pointing to the place. I saw nothing. But he will put his hand there that, see, this is the hair that is growing. I checked. I flashed the light. I used my instrument. I did everything. I didn't see anything. I called my colleagues to come and see if they can see any hair. Nobody saw any hair, but it was of the view that hair was growing in his mouth. That's another case report. And we reported it like that, and I had to call my senior colleagues, and they just were of the view that he might have a psychiatric condition and is just hallucinating or whatever. So things like that, you come across them. In clinic now, as you continue seeing patients, most likely you come across a weird condition that you have not had before, you've not been taught before, that you might have to call people to home, have a look to see if you are doing the right thing. So I think that explains it, except Favor wants to add more. I think that's all I want to say.
That is, sir. Thank you, sir.
Okay, thank you very much, sir, for your response. I really appreciate it, and it was enlightening. I just want clarity on another topic. Basically, so there are incidences where, for example, Breakthrough Action Nigeria or KNCV Tuberculosis Foundation could put up posters in the medicine clinic in hospitals. Like I've seen some in Jute, and then they say that if you see any case of TB, inform KNCV. Basically, it's kind of like a type of epidemiological survey or something that I remember we were taught in class, but I can't remember clearly the term used to describe it. So when one sees such cases and calls on the respective officer with that organization, let's use KNCV for example, what that person is writing to report to the headquarters, will that be called a case report, or what exactly is that called? I just want to have clarity on it. It may be independent of
So
this
that is not
conversation.
a case report. In the context of what you have said, that is just trying to identify an existing case, because some of these conditions, people tend to be having all manners of, is it stigmatism or stigma concerning them? It's like this issue of cleft. Cleft is no longer a case to report or a case series stuff. It's just something that stigma has made people to hide them. So that one is just identifying cases. So when we are, like you said, now you look at the context under which the advert was being written. They are just trying to harvest the cases or let me use the word, harvest the disease conditions. It is not the same case report or case series as had been explained by Favor now. Because a case of tuberculosis is not rare, it's not weird, it's not new, it's not something we have not heard about. It's something that's common, although people are trying to hide it. So in that context, that is not a case report. Rather, you are just like writing about a condition, to add up to the number that the NGO is trying to treat or address or provide solutions to. I understand your question, but I hope you understand my response. So it's the context that will determine the way you interpret that particular case. That particular case, okay, it's like I come to the clinic now and I say, how many cases of diabetes do you have? So a case of diabetes in that context is just how many patients with diabetes do you have? It doesn't make it a case report, neither does it make it a case series. It's just the context that will help you to know what was being referred to. So a case of TB in that context is not a case report. Whatever you write about it is not a case report. It's just an identified case, and you have written a summary concerning what you have identified. I hope it makes sense.
Yes, sir, it does. Thank you very much, sir. Thank you.
Thank you very much, our presenter and Sir and Miss Favor and Sir I did that job for the slides. Also want to appreciate your contributions, Dr. Nii. Thank you very much. They were very helpful and they helped us in understanding the concept of case report and case series very well. Thank you, Christopher Dakat, for verifying and clarifying all your questions because they also helped us understand it better. I also want to appreciate everyone for your presence and for your interest in research. This will make Nigeria a better place and health for everyone better, treatment for everyone better. Thank you so much.